A mammogram is an X-ray of the breast, usually female breast, but men get mammograms as well. It uses X-rays, and it uses a digital, in our case, all of our mammograms are digital. And these days, most mammograms are done digitally. But it uses X-rays and a digital receptor plate, and then the computer takes the information from the receptor and creates an image. And the typical screening mammogram involves taking 2 images of each breast. If you're having a mammogram, you should expect that you'll have at least 4 images taken. The images are taken with the breast compressed, which can be uncomfortable, and for some women it may even be painful. But a certain amount of compression is important for getting quality images. After the images are taken, screening mammograms are typically batch read. They're not read one at a time. Studies have shown that it's most effective to read screening mammograms in a group while you're not doing anything else, you're not having any interruptions, etc. About 10% of the time, a woman will be called back because of something that shows up on the screening mammogram which may be abnormal. And I stress may be abnormal because in most cases it turns out not to be. But of all the screening mammograms done, about 10% have something on them that may be abnormal. And in those cases, the woman is called back for additional views. There may be magnification views done, or spot compression, or rolled views. Those are all various things that can be done to take a closer look at that area that may be abnormal and to see if it truly does look abnormal or not. And if it doesn't, then that's the end. Come back in a year for another routine mammogram. And if it still looks like it may be abnormal, we may do additional things. We may do ultrasound. We may do MRI, not at the same time, but at some other time. And in a small number of cases, that will lead to a biopsy. Now, 70 to 80% of all breast biopsies are negative. So of the 10% that get called back, about 90% will not have cancer. 90% will have something that turns out not to be abnormal, or that may be abnormal and we follow it closely for a while to make sure, or that may need a biopsy. But even the ones that get biopsied, most of those turn out not to be cancer. And I think it's important for women to know that just because of the kind of study that mammography is, most that initially appear to be abnormal, in fact, are not abnormal. Mammography is still the mainstay of breast cancer screening. It is the one study that has been shown repeatedly through prospective trials to decrease mortality from breast cancer. No other study has been shown to do that at this point.